Good afternoon. Welcome to CSG University's Spotlight On, our May presentation today. We were fortunate enough to have two featured speakers, Dr. Bob Erickson, who's a clinical psychologist, medical director for CSG, and Dr. Ron Parente, who's a chiropractic medical director for CSG. Today's topic was biofeedback and some recent trends that we're seeing in coding. So thank you, doctors, for joining us. Very informative. First, I think I'll start with you, Dr. Erickson. What is biofeedback and how has it traditionally been used on patients?
Well, biofeedback is really developed out of experimental psychology and psychiatry. And it developed in the late 60s into the early 70s, the initial stages of it, quite by accident. A neurologist was actually working with a patient with an epileptic seizure and had the EEG coming out. And the patient looked at the neurologist and said, "Would you like to see that pattern again on the EEG?" And the neurologist said, "Really?" And he said, "Yeah, I can produce that again. I bring a certain thought to my mind." And that's really the basis of biofeedback. That individuals, by getting feedback about their cognitive state, what they're thinking or feeling, if they're getting feedback about it, heart rate, muscle tension, temperature, brainwave pattern, they can learn to control it by getting feedback and then using devices that they are taught by therapists to control those functions of the central and autonomic nervous system, which before we didn't know that individuals could really learn to do that, to control it and to regulate it. But by closing that loop with the feedback, they can learn to regulate and make an impact on their biological and psychophysiological processes.
And who is qualified to perform biofeedback? Are there certain qualifications or certifications that you must have in order to do these procedures?
Yes, there are, and it's most commonly done by behavioral health care professionals, psychologists, psychiatrists. It's also done by chiropractors. There's my colleague, Dr. Parente, and other medical, rehab medicine, physical therapy now, because since its inception, it's really developed into all aspects of healthcare. And those who are qualified to do it have had training in it in the sense of either going to courses, continuing education, or they may be certified by the Biofeedback Certification Institute of America, or be a member of the Applied Association for the Advancement of Biofeedback and Psychophysiological Treatment. So there are agencies, there are treatment programs that go for certification in this area, where individuals do get advanced training in it. And that's really what you should find out if you're undergoing biofeedback, that the provider that's delivering it has had some kind of training, continuing education, or certified in the delivery of biofeedback in behavioral health care.
And one last question. What is the typical duration of a biofeedback session that would be common?
Well, in terms of a session, the typical duration can be somewhere in the range of 20 to 30, sometimes 40 minutes, depending upon how the patient presents, what the issues are that they're learning to regulate in terms of chronic pain, anxiety, and so forth. And the typical duration of treatment in terms of episodes, as defined by NIH, and I should mention this, biofeedback is now sanctioned by National Institute of Health in many, many areas of behavioral healthcare and physical medical healthcare. It's typically behavioral healthcare anywhere in the neighborhood of 16 to 24 sessions, sometimes longer if the patient's particularly complicated. If it goes beyond that, then it really has to be justified in terms of the clinical picture.
Great. Thank you for the background on biofeedback. And now I'm going to turn to Dr. Parente and ask him, what are some of the new ways that we're seeing biofeedback being used here at CSG and some of our reviews that you're receiving?
Biofeedback has really been expanded now into the rehabilitation setting. Some of those expansions, if you would, I would say are appropriate and quality use of the technology, and some not so appropriate. For instance, biofeedback is now being used using surface EMG technology to rehabilitate shoulder and knee injuries, where patients have uncoordinated muscle contraction, improper sequencing of muscles firing, especially post-surgically. And so the biofeedback apparatus gives the patient data as to what muscles he's contracting and when, which are contracting first, which he should contract and which he should let stay relaxed, so that proper rehabilitation can occur. Unfortunately, I've also seen some trends where biofeedback is being either inappropriate used, in my opinion, or more commonly miscoded, where the elements, the essential elements of biofeedback are not involved in the service being rendered.
What type of apparatus, you mentioned in the presentation, a particular apparatus that you saw being used as part of the biofeedback technique?
Well, again, an appropriate apparatus, in my opinion, often involves surface electrode technology in the rehabilitation setting. However, I'm also seeing a rising number of cases where they're using an air-filled bladder with a pressure gauge. And they're having the patient basically exercise, quite literally, with the air-filled bladder under the lumbar spine, under the cervical spine, or what have you. The problem with that is it really doesn't measure any specific physiologic function. The patient is merely exercising with the air-filled bladder as part of the exercise program. So it's being grossly miscoded.
Are there appropriate codes that should be used within these procedures? Are they all on a case-by-case basis that when you're looking at them? I know that some of these codes fall outside of the daily cap.
Yes,
You could
yes.
just explain about that a little bit?
Sure. Well, biofeedback itself is an quote-unquote, out-of-cap code. It's 90901. The cap codes are supposed to typify the average office visit, as you would, in the treatment of auto-related injuries in New Jersey. In my opinion, the cases where I've seen where they're using this air-filled bladder, patients really exercising. They're really just performing rehabilitation procedures, which is most consistent with 97110, or therapeutic exercise, which is an NCAT code.
Well, so we got the background of what biofeedback is and some of the common ways that we're seeing these come through today, all in an effort to educate our insurance carriers that we are serving, and we hope this has been educational for everybody. So thank you all for joining us, and have a great day.